My name's Brooke Patterson and I completed my project at the La Trobe Sport and Exercise Medicine Research Centre, and that's where I'm based now. I first became interested in sports injuries during my physiotherapy degree. I enrolled in a project on ACLs, or anterior cruciate ligaments, and then 6 months later I tore my ACL. I enrolled in a study at La Trobe, and then I guess from there my personal and research interest grew. And then a few years later, I was an inaugural player in the Australian Football League for Women, or the AFLW, and I guess recognised a need for an injury prevention strategy to be able to safely grow participation in women and girls. Australia's ACL injury rates are increasing, particularly in women and girls, by up to about 6% per annum, and concussions are also increasing. Women also have worse recovery after injury, and many will go on to suffer long-term consequences after ACL injury, such as knee osteoarthritis. So clearly, prevention of these injuries in the first place is better than a cure. So in this project, we designed and evaluated an injury prevention program called Prep to Play, designed to reduce all injuries, but with a focus on ACL and concussion in community level women and girls playing Australian football. Prep to Play includes a dynamic warm-up with activities such as jumping, landing, agility, contact skills such as tackling, and leg and core strengthening. The biggest problem in sports injury prevention is actually a lot of teams don't use these programs. So when the resources were distributed by the AFL nationwide, while 80% of coaches were aware of the program, few were actually using it regularly. And they reported while the resources were great, they still lacked the confidence and the skills to use Prep to Play. So to better support coaches, we designed a supported implementation strategy where we trained over 50 physiotherapists to deliver personalised workshops and go down to team training and support the coaches. So to evaluate this supported implementation strategy, we ran a large randomised trial. It was the first ever in women's Australian football and the second largest injury prevention worldwide ever. In this trial, we included 2,500 women and girls playing community level football in regional and metropolitan Victoria. So the supported implementation strategy increased the use of Prep to Play fourfold, and importantly, the more that the teams adhered to the program, the fewer injuries that they had. So Prep to Play is now the Australian Football League, or the AFL's core policy to safely grow participation in women and girls, and also boys and men. It's included on their website, it's freely available to all coaches and players nationwide. It's in their AFL tackle curriculum and concussion guidelines. And probably most importantly is that often after a big trial, the work often stops and the resources just kind of sit online. What we've been able to do is continue our implementation efforts with the support of the AFL, and Prep to Play modules, workshops, webinars have been rolled out nationwide, and the program's been delivered to over 5,000 players now. Really, I guess, ensuring that they can continue to participate safely, confidently, stay injury-free and physically active now and in the future.